Hello, my name is Max Shaw, and I'm here with Chris Wolbert. Chris, would you like to introduce yourself?
Yeah, absolutely, Max. Thanks for having me. My name's Chris Wolbert. I'm the team physical therapist and rehab coordinator for Sporting Kansas City. So I'm the return to play specialist when somebody gets injured, I guess you could say.
It's very cool, very cool.
Yeah.
All right, first question. How did you get to where you are now in your career?
Yeah, it's definitely. I'll be honest. It's definitely a long journey. I'll go through a quick process of graduating high school, going to college. You have to get an undergraduate degree in college. And then when you're completing your undergraduate degree, I applied for physical therapy school. Now it's a doctor of physical therapy school. And that is what they consider a grad school, which is 3 extra years beyond just your typical 4-year college degree. And then once you graduate physical therapy school, you you sit for a test, you pass the exam, you become a physical therapist. Sorry. And then from there, you can practice in many various settings. And I was fortunate enough to end up here at Sporting Kansas City, and I'm able to work with athletes every day.
Yeah, sounds very cool, and also like a very long amount of schooling.
Yeah, you have to be very passionate about your studies and really enjoy learning. And I'll be honest, I love doing that. I learn every day, even now that I'm out of school. And it's just a lifelong journey of learning as a physical therapist.
Very cool, very cool. Second question. In thinking about your daily work, what is your favorite part about your job?
Yeah, I think I'm in a very unique setting, working with professional soccer players. I grew up playing soccer, and so that was my passion. Since I wasn't good enough to play soccer at a level beyond college, I felt like this was the next best avenue to be able to stay in the soccer world. So I would say working with athletes, working with professional athletes is probably very rewarding. But then beyond that, thinking from a healthcare provider as a physical therapist, making sure that the injured player or the player who's unable to play because of the injury it returns healthy and returns to the field, and no longer is injured and can succeed on the field. That's pretty rewarding as well.
It's very cool. And to add on to that last question, what would you say is your least enjoyable part about your job?
uh, I don't know if there's anything that's not enjoyable about this position. I guess I have two hats here, because working as a healthcare provider, as a physical therapist, like I said, you can work in many settings. For me particularly, I'm in the professional soccer world. And so if I'm talking about professional soccer, I mean, everything about this is amazing. I'm very honored to be in this position. I'm very lucky to be in this position. And so I would say there's nothing that's unenjoyable about being here. And then to go on the physical therapy side of things as a healthcare provider, um, it's always rewarding, because individuals come to you whether they're injured or whether they're in pain, and you get them out of pain or you get them recovered from their injury, and you see their success, and so everything is just always rewarding.
Very cool, very cool.
Yeah.
Uh, so, what was the first job you ever had in your life, and how did that help you learn work experience in your future?
Yeah, great question. When I was 17 years old, I was a tennis coach for my summer school, basically. So I was coaching and teaching athletes from 4 or 5 years old up to about 45, 50, 60, somewhere in that range, as a tennis coach. And I think that's a unique position to be in, because not only are you teaching individuals younger than you, but individuals older than you. And so I was able to take from that a leadership role, and really learn how to, I guess, lead individuals or kind of be in charge and um, kind of be the one to set an example for others.
Yeah, very cool, very cool.
Yeah.
We talked about this a little bit in the first question, but what did your education pathway look like?
Yeah. So uh, high school degree, 4 years of an undergraduate, so a college degree, and then 3 years of a grad school program. Some are 2.5 year programs, but we'll say 3 years. That then you obtain your doctor in physical therapy. So you get a doctorate in PT, and then beyond that, it's into the workforce, and finding a job. And so all in all, it's about 7 years after high school. There is other opportunities that you can kind of expedite, maybe and shave off about a year or so to get to that end goal of being a physical therapist. But uh, a lot of classes in the healthcare field, a lot of classes about the human body, a lot of classes about a lot of science classes. And so you really have to be passionate about it, because it is, um, like I said, it's a journey through school, and it's a lifelong learning process. So even though you graduate and you've got your degree and you're practicing as a physical therapist, helping other individuals out, you're forever learning, and so you're very passionate about that. So
All right, all right. And so the fifth question is, what is, in your words, is the definition of success?
yeah, so that's a unique question, because everybody will define success differently. I think one thing that I appreciate about success is that it's an internal factor, not an external factor. So you won't, I guess, other individuals won't decide my success. I'll decide my own success. And what I mean by that is, in every aspect of life, whether it's in school, out of school, in sports, at home, doing everything to the best of your ability, in all aspects of life, I think is being successful. Every day you can learn something new. Every day you can challenge yourself to try to better yourself. And I think that's a good internal factor of success. I think the first time that you try to compare yourself to somebody else, or you try to maybe see what they've achieved compared to what you've achieved, you've kind of lost that vision of success. I think it's more of an internal factor. And I think you have to see where you started and where you ended up, and know that you were successful. And so if you can give your 100% in everything you do every day, you're going to better yourself. And then internally, you're going to be successful at what you do.
All right, very, very good answer. Very good answer. I just got one more question for you. And what can students do now to help them prepare for a job in your field in the future?
Um, and I think what it really comes down to is being passionate about the sciences, being passionate about learning about healthcare. Um, at the I guess adolescent age, there's opportunities to potentially volunteer at local physical therapy clinics. What's unique about a physical therapist is there's many different settings you can work in. I myself, like I said, I'm fortunate to be with professional soccer and in the athletic world. Physical therapists work with children. Physical therapists work with elderly individuals. Physical therapists work in school systems. They work in hospitals. They work in nursing homes. They work in many various settings. And so if you can find a physical therapist in your city, sometimes they allow you as students to come in and observe, and kind of just get eyes on what they do with their patients. But then beyond that, it's just really being passionate about your studies and being invested in your studies, especially in the sciences, to continue learning every day.
All right, all right. Well, thank you so much for your time. I'd like to personally thank you. And I'd also like to thank you for helping our students just be able to learn more about different career paths.
Yeah, absolutely, Max. I appreciate. Thanks for having me. Thanks for the invitation, and hopefully, you guys can take something from what I've said, and you guys all become physical therapists.